Hey y'all, there was a great question about scan and view. Scan is SNV. Did I say that wrong? I did. Scan and view. So it's S and the letter V. So S and that's like plus sign V. Scan as in sunshine, V as in victory. So it's just different terminologies with different machines, all meaning the same thing. So scan and view, there's pre-monitoring, there's smart prep, all essentially meaning it's where you're going to take one slice. Some places takes 2 slices or 2 to 4 slices. I don't think it's necessary to scan the patient more than we need to. One slice should be enough. If you know where you're going. Yes, people's anatomy can be different, but you can always go back and take another scan. The technique for it is really low. So I guess the 4 scan wouldn't be that bad, but still it's like, why radiate the patient more than you need to when 1 should be enough? And if you know your anatomy, because you're essentially watching, like if you have the contrast injecting, like you're watching it come into this area. What's important about the pre-monitoring, the SNV and all that is essentially to focus on the arteries. The whole point is to follow it. It doesn't matter with venous phase because that's a routine. You just literally wait the 60 seconds and scan. But for arterial phases, the arteries, you sometimes need to, especially with adults and older folks, it's to trigger off of when their blood flow, the contrast hits the specific anatomy that you're interested in. So let's say for CTA brain for the head, we're going to use this Winnie the Pooh. So if we're looking at the head, normally a regular head, like a regular routine scan of the head, it's like 1 minute or 5 minutes depending on the protocol of the facility, right? It's a delayed phase. But if we're looking at the circle of Willis, which is the arteries for the head, we want to see where it's going to trigger, and we want to know where the contrast hits and make sure that it hits before we go. We want it really bright and fast. So bright and the contrast is illuminating in the arteries. It's not sucked into the organs already. So people's cardiac output is different, and since their cardiac output is different, we need to make sure we trigger off when that contrast actually hits, because sometimes it takes some people 30 seconds, sometimes it takes 40 seconds. It just depends. Sometimes it's faster. So that's why we do a pre-monitoring stage, so we know that the contrast hits where it needs to hit and we scan where it needs to scan. So if we use a head and we're waiting for it to come, we'll go to the base of the skull for CTA head only. We'll like do a pre-monitoring test at the base of the skull, and then you'll get 1 slice here. The contrast will be injected, it'll go through, and then once we monitor and see, that's why it's called monitoring, because we're manually looking at like when the contrast is going to hit. So it's like once it lights up, we then hit go. Or there's the auto trigger where the machine, we already set the point where it needs to go. In the head, it's kind of hard because the carotids and the verts is small, so it's hard to like auto trigger because you might hit the spine. So it's best to do a manual trigger with your hands. You physically have to watch, focus, and then trigger right when you see the contrast so that it illuminates the circle of Willis nice and bright. So that's the important part of essentially having a pre-monitoring slice to make sure the contrast is where it needs to be, and obtaining the perfect aorta or arterial phase of the anatomy that you're interested in. That way you get your scan. So let's say you're scanning a CTA for the aorta, right? So this is the aorta, and you're trying to scan the whole aorta in the chest. And if this is the aorta, obviously the heart and stuff's here. Essentially, this scan and view, this pre-monitoring stage, anywhere you scan, you want to go to the halfway point. So if you're scanning a chest, you want to go halfway. If you're scanning in abdomen, pelvis, so let's say this is your diaphragm, the liver, you come down, this is the pelvis. right? So lungs, sorry. If this is your abdomen pelvis, you just go halfway, and that should be the triggering point. If you're doing the legs, so if you're doing an extremity like a pelvis and the legs, this is the knee. Essentially, if you're doing a runoff, you can go to the femoral or you can go on top of the knees. Normally, the whole thing is you should go halfway, because then it'll move up and then it'll come down and get to your toes. With CTAs, you could start up top. The contrast will come through. If you start up here, the table's going to move up, scan down, and a lot of facilities, they want you to take a double take. So you'll scan the CTA, you'll get the contrast coming down. Sometimes the contrast is too slow or the machine's too fast. Then they'll make you do like a second run of just the lower extremities from the knees to the toes. But for you as a tech, you got to make sure that you're watching your contrast. And if you see enough contrast from the first scan, you don't scan the second scan. You just do the first scan and that's it. I hope that makes sense. Another important thing to remember is if you're scanning a neck, so this is the person's head, their C-spine pretty much, right? You're scanning their neck. You have to make sure you get the aortic arch. So you come down for the arch. So this is the carotids, and then you have your verts. So make sure you get the arch to include in the CTA neck. And the CTA neck, if this is the ears, you want to come to like the EAM area. So this is essentially where your scan should be. But if you're doing the SNV, the pre-monitoring, you're going to go around your aortic arch. So you're going to include your aortic arch. Let's say you put your SNV down here. You don't want to start your box. Like you put your SNV. So if this is your SNV, this line is your SNV, don't set your scanner to go like lower, right? Because if you set your SNV right here and you're watching your contrast come in and you're triggering right here for your Hounsfield, the table is going to have to take a couple seconds to move down and then start scanning up. So if you set your box to start where your SNV is, your SNV and your start box location where you're going to hit go should essentially be at the same line, so you don't waste this couple seconds and then get contamination up here. So that's my advice, to like just start and have your SNV, your pre-monitoring at the same start location, not move it up or down. It's these little things that will delay some scans, and that way your scan can look a lot better. So yeah, good luck.